Extreme gridlock and long wait times are being reported by some hospitals in the GTA, including Brampton Civic. Behind me here, one ER doctor tells me that pediatric beds in Toronto are also in short supply, and this all comes as our healthcare system braces for the next wave.
I'm worried because we're going into a new wave of COVID and flu with the system already very stressed.
Many hospitals across the GTA are reporting a surge in patients at their emergency departments. And this week, the William Osler Health System was warning of extreme gridlock at two locations, Brampton Civic and Etobicoke General.
What does extreme gridlock mean?
That means we can't move people anywhere. There's no room. There's no slack in the system. So that means people coming in by ambulance, there's no room to put them. So you can have cases where paramedics are waiting, 12 hours, even 24 hours to offload a patient. And you have those poor people are sitting on stretchers that whole time, waiting for a bed.
Dr. Kashif Pirzada is a Toronto ER physician and tells me we're in a rare situation where some viruses are circulating months earlier than normal, and a lot of the sick people coming in are children.
We've actually run out across the city of beds for children. So can you imagine when a new COVID wave starts and we don't have any beds available to admit children to? And that's the situation we're facing right now.
And staffing shortages continue to be an issue. The University Health Network telling CityNews that's the main driver behind longer wait times at most of their emergency departments in Toronto. And according to the Ontario Nurses Association, hospitals across Ontario are in similar situations.
If you looked at the big players like Ottawa, London, the GTA, they're probably looking at 500 to 700 nurses short.
To deal with the issue, the Ministry of Health says over 11,700 healthcare workers, including nurses and personal support staff, as well as 900 internationally educated nurses, have been deployed to hospitals across the province with a plan to hire thousands more.
Why is that not being reflected in hospitals right now?
PSWs have been hired. Some nurses have been hired, but not near the amount to account for who is going out the door.
Last week, Ontario's top doctor warned that we could be in a new COVID wave in the coming weeks with new variants circulating, and said if there is a threat to the healthcare system, he'll be recommending the return of mask mandates.
But we're certainly not there yet.
Do you think that the government needs to reinstate the mask mandate now?
I think the time might be coming for that soon. Otherwise, you're going to get behind on these things and the hospitals will be overwhelmed again. Right now, we're sort of sleepwalking into it.
Now, Dr. Pirzada says that the winter is shaping up to be very challenging, in ways that you can help the healthcare system right now is getting boosted, get your flu shot, and to wear masks in crowded indoor settings.